And we're going to start off this evening. Oh no, first I'd like to ask you guys. And Mark, why don't you go first? You've been at this for 40 years, and 40 years in the labor movement, you've seen incredible change over those 40 years. What was it about your experiences that led you to support a single-payer healthcare system?
Well, in the mid to late 1980s, we started seeing increasing employer resistance at the bargaining table to maintain the level of healthcare benefits that we were able to negotiate and bargain for. It used to, when I first joined the labor movement, it was pretty much a pro forma thing. When you went to bargaining, maybe you could get improve your dental plan, get eyeglass coverage or something, but there was no real talk about moving backwards on healthcare. And that really changed in the mid 1980s. And it was a central part of concession bargaining. So in 1988, we actually invited a guy named David Himmelstein, who was a founder of a newly founded group called PNHP, Physicians for National Health Program, to speak at our district council meeting. And he kind of, opened up this whole perspective about a different way of looking at healthcare, as a public good rather than as a insurance product linked to employment. And it really motivated us to investigate this. By the early 90s, there was a change in some accounting rules, which forced many workers off of retiree health coverage. And, this was just so shocking to me that an accounting entry could determine whether, people would have access to health insurance. It didn't change the cost or anything. It was just because of this accounting rule. People were thrown off health plan at their most vulnerable times. So anyway, in the mid 90s, we organized a bus trip to Hamilton, Ontario. We put a bunch of local leaders on a bus. One of our Canadian sister unions hosted us, and we toured the Canadian health plan. And we came back, we passed a resolution at our national union convention, and I haven't stopped since.
That's excellent. Wendell, you, sir?
I became increasingly aware of what happens to people who have insurance. I worked for CIGNA for 15 years, most of it in Philadelphia. And by the way, I lived in Montgomery County for most of my time at CIGNA. So my kids went to Lower Merion High School. So I really appreciate this opportunity to be at least virtually back in Montgomery County. I live in Philly now. During the latter part of my career at CIGNA, I was expected to be, among other things, a cheerleader for high deductible plans. And I knew it was an industry-wide strategy to move every last one of us into a high deductible plan. And I knew, even though I was supposed to be vocally supportive of these plans, that they would not be good for people who have low and moderate incomes. But I also was the person who was responsible, my team and I were responsible for handling what we referred to as high-profile cases. And by this, I mean when someone was denied coverage for something that their doctors said they needed. From time to time, we would get calls, often from reporters who would be asking, why was CIGNA not covering a particular thing that in many cases the doctor felt would save their life? And in late 2007, I got a call from a reporter in Los Angeles who was asking me why CIGNA was refusing to cover a liver transplant for a 17-year-old girl, Nataline Sarkeesian, whose doctors felt she would have a great chance for surviving, living a healthy life if she had that liver transplant. But a CIGNA medical director in Pittsburgh, 2,500 miles away, said, in his opinion, just after looking at some paperwork, that he didn't think it was medically necessary or medically appropriate for Nataline. It became a huge, huge PR problem for the company because the family was able to get a lot of media interested in that story. I ultimately was able to persuade the leadership of the company that this was becoming a big PR problem for CIGNA. Ultimately, the company decided to reverse course and approve the transplant. This came as the family was staging a protest in front of CIGNA's regional offices in Glendale, California. It was being covered by CNN. So once the the company made that decision based on this bad media the company was getting. I had to get the word to the family somehow that Cigna was going to pay for the transplant. And I was watching on national TV when I saw someone from Cigna's office in Glendale whisper in Mrs. Sarkeesian's ear that Cigna was going to pay for the transplant. The family was just, they were celebrating on live TV. And I thought I'd done something maybe helpful to that young woman. I have children of my own, and I could just imagine what the family was going through. Unfortunately, I got a call 5 hours after that Natalie had died. During the space of time that her doctors said and requested coverage for that transplant, she had gotten sicker, and she was not eligible for a transplant by the time that Cigna said it would cover it. And she passed away at the age of 17, 10 days before Christmas. So that was it for me. I had handled so many of those kinds of inquiries in my career. I was just truly fed up with trying to be an apologist for an industry that I knew was contributing to so many problems of cost and access. And I knew too that the industry's tactics were solely to maximize profits. And the industry has erected barriers to care that have only gotten worse since the Affordable Care Act was passed. I advocated for the Affordable Care Act. I think it has done a lot of good. But I said at the time that it was passed that we had to see that as the end of the beginning of reform, that we've got to go much further. One of the first people I reached out to, by the way, when I made that decision to leave Cigna, and that case, that Natalie Sarkeesian case, was the straw that broke the camel's back for me. I turned my notice in just a few days after she died. I began reaching out to advocates to find out if there might be some role I could play in pushing for healthcare reform. And one of the first people that I reached out to was Walter Sue. I remember so vividly that Walter was intrigued. I was still working at Cigna at the time, so I had to do this very quietly. So Walter and I met at a restaurant in Chinatown, Penang restaurant. I'll never forget it. And that was the beginning of my thinking about how to become an advocate. Frankly, I never thought I'd have the nerve to do what I ultimately did, which was to become a whistleblower and a critic of the industry, and to testify before Congress during the debate on what became the Affordable Care Act. But Walter played a significant role in that, and so did PNHP, because Walter is a longtime member of PNHP, which Mark referenced. So that was kind of it for me. I know all too well the problems that people with insurance have in getting the care that they need, whether it's financial or whether a medical director or a nurse or someone at an insurance company will say, no, we don't agree with you, doctor. We're not going to cover that treatment or that medication that you think your patient needs.
Well, we're glad you had the willingness to become a whistleblower and tell us what really goes on inside the industry.